Hello everyone, I'm Dr. Mothir Hanif, Assistant Editor at Dentistry Pakistan, and I'm so thrilled to welcome you all to this live session, Meaningful Marketing Personal and Professional in Dentistry. And I'm so thrilled to welcome our speaker, Dr. Abbas Naqvi. He's Director at CIDE, Canadian Integration by Dental Education, and it's actually talking to us all the way from Milton, Canada. Please, Dr. Abbas, join us in the video, and hello.
Hi, Mohta. Thank you. Thank you for the opportunity. I've been associated with Dental News for a very, very long time. It was actually my first formal employment in dentistry, so there is no way there's no way I can separate from it. It's been about 17 years and we continue to go strong. The association has been amazing, and thank you for this opportunity. What this situation has done is it has given us everyone an opportunity to step back, think and review what are we doing in our professions, in our lives. And I think this is it hasn't ever happened before, and hopefully it never happens again, but I think it's a blessing in disguise that we should take positively. What I will be talking about has to do with marketing. The discussion is in the dental context because dentistry at the end of the day is a business, and every business needs marketing. And we as professionals are also a product. So whether it's us selling our skills, showcasing and marketing our skills to a prospective employer, or whether it is we as a practitioner marketing or selling our services as a dentist. In both the situations, the dynamics of marketing come into play, and they are equally important. I've put together some slides to walk you through the process, and if you have any questions after we're done, I'll gladly discuss those. Okay. So I've titled this presentation Meaningful Marketing, Personal and Professional. Personal and professional. So it's going to walk you through, in this short time that we have, it's going to summarize the dynamics of marketing and how they unfold in these two areas, on these two fronts. So my name is Dr. Abbas Naqvi. I have a degree in dentistry, a graduate certificate in new media journalism, and a diploma in marketing. I'm currently director at CIDE, as was initially introduced, Canadian Integration by Dental Education, director for C-Factor Inc., which is a dental media and marketing company, and I'm also the editor overseas for Dental News. The outline for today's talk will be a brief introduction, some marketing basics, something about meaningful marketing, some common oversights or misunderstandings about marketing, something about communication, because marketing is all about communication, so we have to understand some of those dynamics as well, how marketing works, and how are those principles and how can those dynamics be transferred to personal marketing. So as I said earlier, I have formal education and experience in all three areas, the base being dentistry, where I have a university degree, and I started off in media with Dental News. I later got formal education in journalism from here in Canada, Sheridan College. I got a graduate certificate in new media journalism. And after Dental News, initially starting for about 4 years at Dental News, I moved to 3M, where I was a scientific marketer for their SP products, the restorative and prosthodontic range of 3M. And I spent about 5 years there, and in 2012 I moved to Canada, and I have been doing dental education, media and marketing since then. And I also acquired a diploma in marketing from McMaster University here in Canada. So all three areas, I think I've been blessed to have the opportunity to have been schooled and formally work in those capacities to get a grasp of what these dynamics are, and knowing that most people in dentistry do not formally get exposure to these fronts. Some of the things remain a mystery for many people, and we're trying to address those mysteries in today's chat. Before we go on, I just wanted to share a photo of my family with you. It's my wife, Dr. Sultana, and three children. The elder two girls, Afazia, Kanza, and Benini, who's in this part of Abbas. And sometimes we do tend to get adventurous, but Alhamdulillah, things went fine, and hence I am here in front of you in that adventure. Now, I wanted to take a minute, and I know this is an online session, and this usually works very well when we're doing in-person sessions, but we give you 30 seconds or 30 to 60 seconds on this to look at this and just try to figure out what is the connection between these numbers. Sometimes, you know, there's a relation, there's a mathematical relation. These are in a certain sequence, but if you can figure out what the sequence is, it'll be really interesting to see if you can figure that out. So, if you have not yet figured out that connection, let me tell you that these numbers, you gotta cut this out. थोड़ा सा portion यहाँ पे background में, ठीक है? I'm gonna take a pause and then merge it. So, if you haven't been able to figure out the connection, let me tell you that these numbers are arranged in an alphabetical order. So if you go through these numbers, they are arranged in a sequence, but 99% of the time your brain doesn't process that there could be some other connection in these numbers apart from a mathematical connection. There is no mathematical connection. They are just arranged in. So the reason for showing you this, taking you through this process is to prepare you to think differently, because there are other dimensions, other perspectives that are equally true, and they exist, and we need to open our minds to those things in life. So the first topic of this talk is basics of marketing, some definitions, and to get you oriented with the subject. Excuse me. So how do you define marketing? If you look at the textbook definition, and you see every subject has a Bible. Physiology has a Bible from my guidance, and every dental subject has a core Bible. Similarly, marketing has a Bible from Philip Kotler. So Philip Kotler defines developing profitable customer relations as the definition of marketing. Now, this is a very, very, very simplified version, but still it says a lot. And what I have done from my experience in marketing, I've just reversed the sequence of words slightly, because to me, what I've learned is that yes, it's it's developing profitable customer relations, but I think it is also developing relations that are profitable. So it's just the sequence of your preference. What do you put first? You put profit first, or you put the relation first? So to me, I put the relation first. That is my definition of marketing. And why do we need to market anything? We need to market anything because we need to sell. And we need to sell what? Either a product or a service. So, and you know it pretty well that we can barely survive. We cannot survive without products and services in our lives. We have to have those things. Look around you. And this brings us to the important realization that we, as professionals, as I said in the beginning of the presentation, that we are also a product ourselves. We are a product. And what we do and what we sell in terms of dentistry or any other service is a service. So both these fronts need marketing. Now, what are some of the dimensions of marketing? Marketing can either be business to business, and it's more commonly called B2B, and it could be, you guessed it, B2C, business to customer. So the marketing dynamics in these two dimensions are slightly different. B2B marketing is a business selling its services to another business, like C Factor. C Factor is a media and marketing company that sells its services to other businesses, which could be a dental clinic, which could be another dental organization, could be anyone who needs the services that C Factor provides. Business to business marketing is like more relationship based. It has a deeper engagement between the customer and the business, and it takes place over a longer time. It doesn't happen overnight, doesn't happen quickly. B2C, on the other hand, is slightly superficial than B2B in terms of the business to customer relationship. It's a relatively, for example, if you go to buy a biscuit from a supermarket, you've never met the CEO of that biscuit company or their higher management. You don't know these people, but it's their product. You're just going and picking it up. So it's a slightly it's a shallower relationship, and the transactions tend to happen in a much shorter time. They go in, get the stuff out. That's all. So those are, again, oversimplifying the equation, but yes, that for now, this is how this is all you need to understand in these dynamics. Now we talk about some concepts and misconceptions in marketing and making it meaningful, and as well as addressing some buzzwords or phrases. So a very common concept, people use the words advertising and marketing interchangeably, but they're not the same. Advertising is not equal to marketing. Marketing is greater than advertising. Advertising is a component of marketing. It's just one component of marketing. Okay? So next time you want to talk about advertising and marketing, please understand these are two separate things. Marketing drives advertising. It's not the other way around. Marketing and sales. People again club these two things together. They're two different things. And what's the basic difference? Again, this is a marketing 101 session, so very basics. Marketing is the pull. You are pulling people towards your product. You are telling them something where they will turn around and ask you about it. It's about creating the attraction. Sales is when you're pushing the product towards them. You are pushing the product towards them. So there's a basic dynamic difference of a pull and a push between marketing and sales. And that's why salespeople are generally considered to be pushy, right? Why do you feel that a salesperson is pushy? Because it's pushing, right? So that's the difference between marketing and sales. You will never find a marketing person to be pushy. And if he's pushy, then he's not a marketing person, or he's not doing marketing at that time if he's being pushy. Now, with the advent of internet, people think that it's all about online. And online is in and conventional is out. By conventional, we mean print, we mean in person, and all those good things. But it's not completely true. Because we actually need to balance the real and the virtual. Because guess what? The source of virtual is real. I am here. You can virtually see me talking to you because I exist in the real world. If I was just a virtual entity, now this obviously there are some exceptions to this, because there are some purely virtual businesses, purely online businesses, but they still, at the end of the day, somehow they have a real connection. So you have to balance the two. You cannot do a lopsided marketing approach towards just marketing online and just forget the conventional print and in-person and all other media. And you cannot just overlook completely the real the online and just focus on print and interpersonal. So there has to be a balance. Some being dentist, now this is with the dental context. We think that, okay, my skill to extract a tooth or my skill to perform a good endo, ortho or whatever I do is the only thing I need, and I don't need any communication or business skills. The determinant of my success is my clinical skills. But here's the reality. This is not true. It's good, it's important to have skills. Obviously, you can't do anything without having the basic skills, but those are not the determinants of your success. Most successful people in the professional world are either better at business and communication or are equally good on both sides. So, the clinical skills and business skills are unrelated to some extent, and communication is imperative to business growth. Some people also equate marketing to lying. They think that marketers are, they lie and they create false expectations. Well, some do, but that's not the principle. That's not how it should be. Some do. But the idea is to create value. That's what marketing does. It creates value. So for what you have to charge a price for your product or service, right? You're going to be hired by someone, they're going to pay you a salary. So if you can set yourself apart from the others, you can probably get paid a slightly bit more than the others because you're better qualified, you're doing better quality work, or you can do a more diverse set of work, right? So this is like, I'll give you an example. In the beginning of my career, I'm not sure what the salaries of a demonstrator are at the moment in Pakistan, but would you believe me, when I started in 2003, the salaries were about 7,000 was the ballpark number, okay? And I started teaching immediately after my house job at that salary. And because of my diverse interests in media and marketing, I was able to get a job at that time that paid me twice this salary. So I was a young grad, but I found a job that paid me twice the salary of an average demonstrator based on the value creation. And the value was I was able to do a lot more other things that the regular demonstrator couldn't. I could teach as well and do administrative and marketing and other things. So there was value, and someone hired me at twice the salary. So that's what I mean, just to give you an example. And in this day and age of information overload, you got to filter out the information, filter out the sales information from education, because right now both are very deeply intertwined. And because sometimes the information that you get is sales information that's being called education, and sometimes it has many fundamental flaws, and you must know the difference between when you are being educated and when you are being provided with sales information. Okay, so few points on that. Common oversights are consistency. People lack consistency. Sometimes you start investing in a marketing project or a marketing plan, but your expectation from it is like it's Aladdin's lamp. It's a genie will somehow turn your world around very quickly. It doesn't happen like that. You have to be consistent. You have to demonstrate patience, both in. You have to be consistent in both patience and your execution and the messaging and the branding. Don't keep changing the message too often. Don't keep changing your visual too often. Keep things consistent as much as possible. That's when it starts to create effect. And control. Consistency and control are the two most commonly missing um, elements. By control, we mean look back and see over time what result did your previous efforts bring you. Okay. Keep in mind the Pareto principle, which is the 80-20 principle, which means 80% of the results that you get come from 20% of your efforts. So figure out over time what are those 20% efforts that bring you 80% of the results. The entrepreneurship fact, it's become a buzzword. Everyone is an entrepreneur. But and especially with dentists, it's even more common because dentists are basically business owners. They're supposed to be business owners. The dynamics in Pakistan are slightly different in South Asia, I would say, where young graduates are kind of forced to think about postgraduate education, and they kind of evolve into a more employee-based mindset. So that is unfortunate, but dentistry as a profession is basically a business, and a dentist has to have a business mindset. And this has to start early. The only problem is that people get to this point, the entrepreneurship thing, slightly later than they should, but I'm seeing this change recently, and I've seen many young professionals pick this up earlier. And if you look around on social media and around you, you will see those people stand out with their entrepreneurship entrepreneurial approach. But we need to understand the difference between two important things, the entrepreneur and the intrapreneur. These are two different types of people, and because they both exist, they have their own place in the ecosystem of business. Entrepreneur is a person who organizes and operates a business, taking on a greater than normal financial risk to do so. Whereas an intrapreneur is an inside entrepreneur who uses entrepreneurial skills without incurring the risks associated with those activities. So this is a symbiotic relationship that needs to exist in every business. You have to have the entrepreneur, and you also need the intrapreneur. Because this is the person, intrapreneur is the person who you can leave things to. Again, I'll give you an example. I'm giving you all real life examples from myself so you can relate it that how these things play out in the real world. So when I was at Dental News physically, I was responsible for the product cover to cover. And only when I had a problem doing that would I go to the entrepreneur. Because he was able to delegate it. And this, again, this doesn't happen overnight, happened over a few months, years. He was able to give me that responsibility and then go do other stuff that he needed. He didn't have to worry that the design, there will be design issues, there will be text issues, there will be photographic issues or stuff. He didn't have to worry. But it was his financial risk, the business. He owned the business. I didn't have a financial risk, but I treated the product as my own. So that's the difference. Okay, that's a good enough example. And there's a book called I'm recently I'm reading that book these days, and you should. The E-Myth for all entrepreneurs. You have to read this book, E-Myth. I have it here. I can show it to you. The E-Myth by Michael Gerber. And what it does is it opens your mind towards how you should be running a small business like your dental practice. And a very important thing, I'll just give you an example and then move on, that it tells you that inside an entrepreneur are three people. Inside a business owner are three people. The entrepreneur, who is the visionary, who wants to change the world, then the manager, and then the technical person. The technical person who does the actual work. So these three people have three different sets of qualities. And sometimes, and more often, these three people fight with each other. But these three people are living in one person, in you, in me. Okay? So and no individual apart from exceptional people can balance these three people. Someone has more of an entrepreneur, less of a manager, and less of a technical person. Someone has a lot of the technical person, less of manager and entrepreneur, and someone has a lot of manager and less of the other two. So the balance, definitely, that's where the entrepreneur comes in, because here's where you need the balance, those qualities and skills. Let's talk about communication and the elements of communication, because marketing is communication. The marketing message is the first element which creates the value. And then you have media that you use to convey that message. And then there's a receiver who receives. The messaging process. The messaging process involves encoding by sender. The message then gets carried by the carrier. It could be a verbal or visual. And it's received and interpreted by the receiver. And now we're becoming more and more visual. Seeing is believing. And then this reception and interpretation creates a perception. So if you see all these steps, you have to make sure at the time when you are encoding the message, you have to consider all these other steps where things can go wrong. So you have to address these steps just to make sure that what you're saying in the beginning of the process encoding is what it gets perceived at the end. Okay, so nothing goes wrong in the middle, because perception is reality. And here's the response generation process, the CIDE process. You have to get someone's attention first, then generate the interest, and then create the desire in them to take the action. Again, someone who's receiving that message is going to go through these steps. And you have to walk through it. You have to keep in mind that that person is going through this process. And how can we make our communication more impactful? There are some references to that. You see, listening or speaking is the least effective form. So what I'm doing is I am speaking and you are listening, but I'm showing you something as well in your eyes, in front of your eyes, that you can see what I'm visually see, what I'm trying to walk you through. Next comes seeing, which is slightly more impactful than just speaking and listening. And the last is experiencing. You can say anything about your practice or your procedures verbally, and people will listen. Someone will come and see, but unless they sit on your dental chair and go through that process, unless they walk into your clinic first, experience how your front desk talks to them, experience the ambience, experience the comfort, experience your personality, experience your protocols. This is what will have the biggest impact. And on the other hand, when we are communicating, we have to keep in mind that human beings are essentially not logical beings. We are emotional beings. So the impact of what I say, no matter how logical I sound, there has to be emotion, there has to be passion, there has to be thought. Yes, thought, insight, rational is important, but then what will create the impact is emotion. And yes, you see every day our media channels are killing it. They are overkilling that part. The emotional part, they're drumming it up too much. Yes, they're overdoing it. You see it in movies all the time, especially South Asian movies, overly emotional. Yes, but why do they do it? Because, and this connects to the experience on the other side of the screen. You see, experience and it's emotional because the two are connected. And all these points are connected to what I've been saying before this, you know, the messaging process, the encoding, all this is an intertwined, jumbled up mass, but you have to work your way through it. So that's what will bring impact to your communication. Now, when we talk about having a visual media set, you should having communication is becoming more visual, right? So you have to have a visual media set for whatever that you are marketing, your practice for yourself. Clinical photos, social photos for social media, headshots, events, infographics, videos. You can make videos for educational procedural videos, social professional videos. So everything that can be made visual should be made visual is in this day and age when it comes to marketing and communication. Now, basic levels of marketing, as we said earlier, there's commercial marketing, there's personal marketing. Commercial marketing means when you're marketing a product or a service. Personal marketing is when you're marketing yourself. What happens in the marketing process is step number one is that you need to understand the marketplace and the customer needs and wants. The second step is designing a customer-driven marketing strategy. Yeah, you need to understand here at this point that strategy and tactics are two different things. Strategy is a long-term approach. You chalk out a strategy that you're going to, in about 3 to 5 years, this is how this product and its marketing approach will play out. And tactics are quick responses or short-term measures that any business or any marketer takes to take the business up a notch. So there's a difference between strategy and tactics. Tactics are short-term measures. Strategy is a long-term thing. So you have to design a customer-driven marketing strategy. You have to construct a marketing program that delivers the value. And this leads to building profitable relationships and creating customer delight. And at the end of the process, you capture the value from the customer. Now, here's the important thing. You see, these are so many steps, so many spread over. But when it comes to making the money, do you see in this process that making money comes right at the end? You're capturing the value from the customer at the end of this process. So please, this connects back to when I said you need to have patience. Once you are a business and you are marketing something, it's not going to happen overnight. It'll take these processes that you see on your screen right now for the last step to happen. And you might have heard a lot about this word, marketing management. Someone is a marketing manager at a company. Now, what does a marketing manager basically do? Everything is being oversimplified here, but I'll tell you what they basically do. They segment the market based on any variable that could be, and there are many variables. You have to segment the market based on different variables like geography, like age, like gender, educational status, employment status, monthly income, and so on and so forth. So you segment your market. For example, in dentistry, you might want to talk about there are different market segments. There's students, there's faculty members, there are private practitioners, and there are house officers. So that's one way of segmenting the market. And then you create products based on their individual needs for a different market segment. The product or service that is being offered to a private practitioner cannot meet the needs of the students. What you're offering for the students cannot meet the professor, right? So you have to address those market segments separately. Then you choose your target segment. Now suppose in these market segments, you have a product, you only want to focus on senior professors of the industry. So then the marketing plan will not include targeting students or house officers. So the marketing plan will target just the professors, right? And the opposite is also true. There's a product that is designed specifically for the students. It won't be marketed to the private practitioner. And the third level is building profitable relationships. So these are basically, this is the job description of a marketing manager, but it's not that simple, trust me. How do you create an integrated marketing plan? Now, the word integration is extremely important, and this is also one of the reasons we named our educational center Canadian Integration by Dental Education. Even in marketing, an integrated approach is very important because what you're doing connects with something else. So we have a marketing mix, and the different elements of the marketing mix are related to one another and are integrated. This is the famous 4 or 5 P's of marketing: the product, price, place, promotion, and person. This is, at the end of the day, what creates a marketing mix. What is the product? How is it priced? For what market segment? From the previous slide, right? You segmented the market. And what's the place where this product will be available? How this product will be promoted? And who's the person involved in the process, on the front end of the process? This is what will give you the marketing mix. And to manage all these relationships, at the end of the day, we're talking about creating profitable relationships. To manage this, you have to have a CRM system, customer relationship management system, and you have to understand the dynamics of the changing nature of customer relationships. So what is a CRM system? A CRM system essentially is a database, excuse me, essentially database management, where you have anything and everything that is going on with your customers, between your business and your customers, recorded. In a dental practice, it could be your dental software. And that is why a dental software is very important for dental practice. I think there are parts of the world that have not yet picked up on this, but they are in the process, and they should, because in this day and age of technology, everything that you incorporate into your processes has an importance, and so does a dental software. So in a dental practice, your dental software is your CRM, and every business that needs to succeed has to have a CRM system. And the changing nature of customer relationship means that you cannot be everything to everyone. You have to relate carefully with selected customers that previously we've discussed. You've segmented the market, and you're targeting only that market segment. So you are filtering out the irrelevant portions of the market. And now you are relating more deeply and interactively with the segment that you selected. The other dynamic is that this is now becoming a two-way relationship. It has a lot to do with the customer now, And in fact, it probably has more to do with the customer. It's just like on social media, you cannot control the reviews you get, right? You can and you cannot. So it's a two-way relationship, and you have to understand the customer side of that relationship. The customer has a lot more control now than in the past. And you can do consumer generated marketing. This is not a new concept. You see, sometimes companies do competitions. They invite you to sing a song and send them a video and all those things. What is that? That's consumer generated marketing. You're creating a marketing content for them. You're creating a video and sending it to them, and most likely you will also share it on your social media, right? So basically, what are you doing? You're helping them do their marketing. So that's what is the added dimension of consumer generated marketing. Now, what's the product when it comes to personal marketing? As I said earlier, the product is you, right? So you are a product. You need to market yourself as a product. And what do you need to have? You need to have two important things in you, except for applying. No, I'm not going to say what I was going to say. People will troll me to death. So you have to have the knowledge and the skill, because without these two things, a pretty face can only get you so far, right? Probably it'll get you further in a modeling career, just a pretty face without these two things. But you have to have, I'm talking from a dental professional perspective, you have to have knowledge and skill. Knowledge, both clinical and business, and skill, both, all three, clinical, communication, and management. This is what you need to be, the product that you need to be. And if you're missing any of those, just remember there's still a customer for every product in this world. So don't get demotivated, but try to polish your skills on these areas and try to improve yourself as much as possible, because what you're doing, you're doing product development as they go, improving the product, right? So this is what the product should be about. And how do you market your message? Obviously, everyone has a resume. I see a lot of resumes. Most of them need significant work on improving them. Make sure you have a decent design. It's well organized. It has a logical sequence to it. It highlights your achievements and your profile in a nice way, in a fair way, in a presentable way, and highlights. You see, use the different ways to highlight what is important and play down what is not important. You can use visual tools like bolding the text, enlarging the text, and different elements, and in the sequencing of things. If you are a fresh graduate, your resume will have a different sequence. If you are a mid-career professional, your resume will be slightly different. And if you're a senior professional, your resume will be different. So use your strengths, use this platform, the resume, to showcase your strengths and portray yourself in the best light as possible. And continuing education profile is very important. It reflects your ability to learn, your interest towards learning, and that is very important these days. And give it a personal touch if possible. Talk about yourself as a person as well. Beyond this, again, as I said earlier, I see some of the newer professionals pick up really nicely on this. Be seen, be heard. Both online and in person. In online, if you are camera comfortable, and if you're not, make yourself camera comfortable. Get involved in activities and showcase that involvement. And in person, network. because as they say, your network is your net worth. So you have to focus on that. Get involved in continuing education again. That continuing education serves two purposes. It educates you and it helps you create your network. So for both reasons, get involved. Showcasing is important. Showcase everything that you get involved with as much as possible. Your involvement in educational activity, any hobbies that you pursue, any causes that you pursue, any skills that you pursue them and showcase them. It also creates motivation for other people. What you should have is a headshot, a video maybe, a video resume, your practice team shots, virtual tours, photographs from events, testimonials, and you can put all this content on websites, social media, flyers, ads. Be original. Sometimes people use stock images in their marketing pieces. Please don't do that. Use originals as much as possible. This applies both in a personal and a professional context. When you're marketing, this is the media set that you should have, and on your right are the uses that you can make of it. Backshot is your personal brand statement. I'm just going to show two examples of what it can be and then what you can make of it. You can probably put a photo from a game. This could be your profile picture, but if this is your profile picture, if this is what your profile photos look like, obviously the impact will be different, right? You could also go for corporate picture. So this also showcases you in a different light. So be visual, focus on these elements. They're important. Seeing is believing. Visual impact is important. Team photos, again, as I said, be original. Get good quality work done. So these are visuals that are original and impactful, and they will help you create a better recognition in your field of interest. If you're a practitioner, if you're whichever market segment that you want to create an impact in. Videos are important. I've created several videos for several people here in Canada. And showcasing is important. Keep in mind, showcasing is not shameless self-promotion. There's a slight difference. So there's a fine line, and not many things can be articulated in a verbal fashion. I can't probably teach you to know the difference, but there is a difference, and experience usually is the best teacher when it comes to drawing that line. The exposure needs to be repeated. This connects to something I was saying earlier in terms of consistency, and repeated exposure gives you multiple touch points, and multiple touch points give you the top of mind position that that any company or any business is looking for. So when someone asks you, okay, who's a good dentist in the city, and your name comes up, not necessarily because you're a good dentist, well, you should be, but probably because that person has seen, read, heard enough of you to create an impression that you're a good dentist. And obviously, seeing is believing, so you need to showcase. So what are the concluding thoughts? This is very important. Because we've been talking about the marketing process, you need to understand that in the real world, no one wants to be a part of the process. Any process. But everyone wants to be a part of the outcome of the process. Of course, when you set up a business, the business will have its teething problems for at least 3 to 5 years in the beginning. And it's a process, and you have to go through that process. But after those 3 to 5 years, when your business, whatever that business may be, a practice, an educational institute, any kind of business, when it takes off, that's the end of, not the end of the process, but the conclusion of the process. And everyone will want to be your friend, and they will want to be associated with you once you've hit that point. But up till that point, you have to be committed. You have to see that time through, because it's a matter of perseverance, patience, and a lot of hard work. So remember that being a part of the process is important to the outcome of the process. There's a couple of upcoming initiatives that we're going to start here in Canada: the Canadian Association of Dental Office Management and the Canadian Dental Associates, with some helpful information available for whoever is interested. These are some of the ways, probably all of the ways, that you can reach out to us at CIDE through our website, our email, our cell phones. Here in North America, the international code is +1. Facebook, WhatsApp, LinkedIn. You can connect with me directly on LinkedIn or through any of these other ways. I'd like to thank you for your time, for being a patient audience. And if you have any questions, probably around COVID-19, which is the hot topic.
Yes, I actually very much have the same question. So, the situation has definitely been upside down, because of the corona and the whole lockdown. There has been a huge setback that people can feel. So, any tips for them, for the dentist, how to overcome that financial setback?
Well, the most important thing here is two important things. Obviously, understand that it affects everyone equally. And the second most important thing is to stay connected. There's a very famous couplet by Allama Iqbal, who said that millat ke saath raabta-e ustwar rakh, pevasta reh shajar se umeede bahar rakh. Stay connected. And this is a very universal statement. If you have a patient base, stay connected to them. And here's also where the CRM comes in useful. You pull out your patient list, call them, ask them, how are you doing? If you need anything, ask them if you need anything. Everything going okay? Is everything in your house, is everyone in your house doing well? Do you need any help? And if you need, most likely they will just thank you for your call and not ask for anything. Most of them, but they will appreciate that you thought of them.
Yeah.
Secondly, suppose one of them, two of them turn around and say, yes, you know what? We're having this problem at home. Or yeah, maybe I'm hoping someone can help me with this. And suppose you can help them with that problem.
Yeah.
Imagine the impact your contribution would have had on their life, instead of you just telling them, oh, we're just closed and I'm just a dentist, this is all I do. No, but you're a business. You are responsible for taking care of them as an individual, as a person living in that society.
Sure.
And as a business as well, you have to take care of your customers. So try doing that. Don't disappear. Stay connected. Keep sending meaningful messages. If you have a database, maybe you can text them tips on oral health. Maybe you can email them. Maybe there's so many things. And keep your social media active. Make sure your patient base is connected to your social media. This is even so much more important today than it has ever been. Pull out your patient lists, send them a text message, maybe send them a link to your social media and invite them to connect. And there's so much meaningful activity.
Exactly. I think the situation that we are in right now, it's all about being empathetic and just trying to bring back the humanity, both as a dental professional and as human as well. And with that, we have actually reached the very end of our session. Thank you, Dr. Abbas, for taking time out of a busy schedule and guiding us through your knowledge. It's been always a pleasure to have you on board, and I'm sure that the listeners have also enjoyed the session as well. Thank you once again, sir. Thank you.
Thank you, Mathu. Thank you for the opportunity. Take care. All the
Thank
best.
you. Allah Hafiz.